Today's video is about B complex, B1 basically. So thiamine. Thiamine was one of the first vitamins to be discovered, the first B complex vitamins to be discovered. It's a very important. It's a very important vitamin because it's used for energy processing. So whatever energy that your body needs goes through a series of chemical processes, and B complex is part of each of those steps of energy production. And B1 is very important. B1 is found very commonly in lots of foods. So a massive deficiency of B1 is rare, and we started finding B1 deficiency only when we started using grains in a large quantity. So up till then, B1 deficiency, beriberi, was not very common. So the disease beriberi started to become common as more and more grain-based diet became popular. So the poor people started to use more grains because it is cheap and it could be stored for longer and you could transport it over long distances. And the grains have some amount of B1 in them. It's just that the amount of energy that is contained in the grains is very high. And you need more B1 to deal with that kind of carbohydrate load. So even though B1 is found in grains, there's not enough of it to deal with the carbohydrates that are present in grains. Now, you need it for energy processing. You need it to produce myelin sheaths for a nerve. So a nerve is covered by a sheath, a protective sheath that enhances its function. Some nerves are myelinated, some nerves are not. And the myelinated nerves require the myelin sheath, and production of the myelin sheath also requires B1, quite a bit of B1. Now, and the nerve activity, how irritable the nerve is, all of that depends on how much B1 is available for the nerve and how much myelin is available on that nerve. So when there is a deficiency of B1, you will have problems that will be visible in tissues that use a lot of energy and the nervous system, because nervous system you need B1 for its structural function also. So you'll find that muscle gets tired easily. You'll have lots more aches and pains. You'll have slower repair of injury. So that is when it comes to muscle. In the heart, you'll have congestive cardiac failure. So there's no real reason. There's no blood supply issues. There's no valvular issues. The heart is just failing. It's not functioning properly. That can be because of a B1 deficiency. It can also be because of other micronutrient deficiencies, but B1 is common among them. You can have nervous system problems. You can have brain fog. You can have tiredness. You can have lethargy, lack of motivation. And you can have irritability, anxiety, seizures. So you can see that all of these symptoms are very non-specific. You can't really say this is only B1. There are other micronutrient deficiencies that can cause the same problems. So, but when you see these symptoms, you should think about a B1 deficiency. Now, in the past, so B1 is predominantly, even though it's found in all kinds of food, you'll find it more in non-vegetarian foods. So you'll find it in meat and eggs, and you'll find it in organ meats especially, so liver especially. But in the past, vegetarians didn't have much of a problem because the B1 and the B complex vitamins are still produced by your microbiome, your gut bacteria. The problem with modern day is that, one, we are using a lot more B1 because we are consuming larger amounts of carbohydrates, but we are also having a less optimal microbiome compared to the past because the environment is toxic and your microbiome is very suboptimal these days. We've all been through multiple courses of antibiotics, and most of our microbiome is nowhere as diverse or as well functioning as a microbiome that was present 100 years ago. So vegetarians who used to be okay 100 years ago are now going to have a B complex deficiency, and especially a B1 deficiency, because their microbiome is not as optimal as it used to be 100 years ago. Even the vegetarian diet that used to be 100 years ago is very different from what it is now. So By some studies, up to 30 or 40 plants need to be consumed regularly for you to get the diverse amount of the microbes that you need for a healthy lifestyle. We don't consume 30 to 40 types of plants every week. We hardly consume 5 or 6 kinds of plants regularly. So it's of these, there will be 3 or 4 types of grain, and then you'll have your favorite few vegetables. And on top of this, you've got the processed foods, you've got your stressed lifestyle, and you've got the toxin exposure throughout the day. So all of this contributes to a very poor quality microbiome, and which makes it difficult for humans to make their own B complex and make their own B1. So then there's the issues with drugs. So multiple drugs that we consume regularly are causing damage to the microbiome, are causing damage to the gut, and are also depleting the B1 that the body produces or consumes. And again, this is again making the deficiency of B1 quite a significant, serious problem. So NSAIDs, painkillers, alcohol. So even one drink a day can cause enough of a microbiome disruption, and it can consume enough B1 from your diet that you go into a deficiency. Now, a deficiency that is high enough to produce, a deficiency that is bad enough to produce beriberi is rare. That's never going to happen, because these days you've got B1 supplementation even in the grains that you consume. It is legally, the manufacturers are bound to add B complex into your bread and into your flour, so that people don't go into a deficiency. But in spite of all of that supplementation, you're still going to get a problem because of all the other issues I've talked about. So how do you deal with this problem? One thing is to reduce the amount of grain consumption, and you definitely reduce the amount of flour-based foods that you consume. You have to reduce the amount of processed foods that you consume. You've got to make more of your food at home. Then you've got to increase the quantity of vitamin B complex rich foods, which is non-vegetarian foods. And people will complain about cholesterol and stuff, but you choose. Do you want a B complex deficiency, or do you want to worry about the cholesterol myth that has been busted several times over? Pick almonds and peas and fermented foods. You'll have to also consider supplements. I'm not a fan of supplements. I would rather that my patients consumed a small quantity of liver every week. But if you can't do that, either because of taste or ethical concerns or whatever, you'll have to take a B complex supplement. You'll also need to help that B complex supplement by using zinc and magnesium and even vitamin D. Now, I can't go through which drugs to take, which brand to use, which dosage to take on the internet, because I can't give out prescriptions on the internet. And also, each of these supplements need to be taken in a manner that is best for one particular patient. I can't give out a blanket prescription like I gave for vitamin D intake. So, yeah, you'll have to see your doctor, and you'll have to check you'll have to see which tablet is best for you. Now, then there's the inevitable question as how do I know if I'm deficient in B complex? You will see lots of blood tests that will tell you your B12 level, your B1 level, your folate level. Those are all blood levels, and the blood levels are kept very strictly controlled by the body, because the body knows how critical it is. So, and your tissues are going to be starving of B1, and you're going to have all the deficiency symptoms, the mild deficiency symptoms, but you will not see it on the blood levels. So checking the blood levels is not actually worth the money you spend on it. So I usually advise my patients to take the B complex supplement anyway, because B complex is a water soluble set of vitamins, and they're not going to have toxic symptoms if you take extra. It is just whatever you take is going to get peed out if it's more than enough. So take the B complex supplement or use any of those foods that are higher, better quality sources of B complex, and use zinc, magnesium, and vitamin D to help the B complex that you're consuming, or the B1 that you're consuming. I can tell you that benfotiamine is a fat-soluble form of vitamin B1, and that is better absorbed and it is better for your nervous system. Or you can have thiamine mononitrate. So these are the two formulations that you'll be looking for. But I'll not be able to talk about the dosages on an internet video. So if you got further questions, ask them in the comments. But I won't be able to give you any prescriptions on the internet. Thank you.